Knock, knock. Hi, my name is Erin. I'm going to be your nurse for today.
Hi.
Hi. I'm going to go ahead and close the door and pull the curtain here, provide you some privacy, and I'm going to perform some hand hygiene. Really quick, I'm going to check your bracelet. Can you tell me your name and date of birth?
Alexa Starry, 10/24/1996.
Awesome. Alexa, do you know why you're here today?
For a regular checkup.
Do you know where you are?
My doctor's office in Iowa City.
And what day of the week is it?
It is a Friday.
Awesome. Are you experiencing any pain on the scale of 0 to 10? 0 being no pain, 10 being the worst you've ever experienced?
No pain, 0.
Okay. Patient is a well-groomed, well-appearing individual, appears stated age, alert and oriented ×3, no acute distress, 0 out of 10 pain, and has a Glasgow Coma scale of 15 because she's able to conduct the interview. Before we start our physical assessment, I'm going to go ahead and ask you some questions to help guide us. First of all, have you had any changes in your health as of late?
No.
Any new moles or skin lesions?
No.
Any headaches?
No.
Nasal congestion or seasonal allergies?
No.
Have you had any changes in your hearing, taste, or vision?
No.
Any neck pain?
No.
Any difficulty swallowing or cough?
No.
Have you been having any heart palpitations or fluttering?
No.
Have you had any changes in your bowel or urinary habits?
No.
And have you noticed any swelling in your lower limbs or like maybe a change in shoe size?
No.
Okay. I'm gonna go ahead and inspect your skin. You just touch the back of my hand to the back of yours. Skin is warm, dry, pink, and intact on exposed skin surfaces. Really quick, I'm just gonna test your capillary refill. It's less than 3 seconds. And then I'm gonna go ahead and palpate your radial and your brachial pulses. Pulses are 2+. Then I'm gonna go ahead and inspect your head. Head is symmetrical, normocephalic, atraumatic. I'm gonna go ahead and palpate really quick. Any tenderness?
No.
No tenderness upon palpation. Then I'm going to go ahead and test the patency of your nostrils. Can you hold one nostril and blow out your nose? And then switch sides. Nostrils are patent. Really quick, I'm going to inspect your ears. No skin breakdown. Ears are symmetrical. No moles or lesions. I'm going to palpate the auricle of your ear and the tragus. Any tenderness?
No.
No tenderness upon palpation. Now we're going to do a couple of eye exams really quick. First I'm going to make an H. If you can just go ahead and follow my finger. Then I'm going to bring it into your nose. Okay, E1s are intact. I'm going to take a pen light here and just shine on the sides of your eyes. Okay, perla is noted, and I'm going to go ahead and inspect your eyes. Conjunctiva is pink and sclera is white. Really quick, we're going to test your cranial nerves. Can you go ahead and puff out your cheeks for me? Raise your eyebrows, stick out your tongue and say ah, and then give me a smile. Okay, cranial nerves are intact. Moving on, we're going to go ahead and inspect your neck. Can you go ahead and swallow for me? Trachea is midline and symmetrical. Do you have, can you turn your head side to side? Full range of motion noted. And then really quick, I'm going to auscultate your carotid. I'm going to ask you to hold your breath and I'll hold my breath with you. Okay. Carotid pulse is 2+, no bruits noted. And then moving on, we're going to do a couple of range of motion activities. First, can you go ahead and extend your arms and then flex them, then extend them back out. You're going to hold a bowl of soup, supinate, and then pour it out, pronate. Then you're going to raise your arms above your body, adduct, and then bring them back down. Raise above your body, abduct, and then raise put them back down, abduct, adduct, adduct, down. Okay. And then go ahead and stick out your arms for me. We're gonna do a couple exercises. Can you go ahead and push in and push out, and then push up and push down. Okay. Full range of motion noted. Muscle strength is symmetrical and 5+ bilaterally. And moving on, we're gonna go ahead and listen to your lung sounds. I'm gonna oscillate the anterior apices of your lungs above your clavicle here, starting on your right side and then moving to your left for one full breath sound. Then I'm gonna come down to the second intercostal space on the right side and then moving on to the left. Lung sounds are clear. Posteriorly, I'm going to oscillate the apices at the C7 level. I'm gonna go left to right, moving onto the middle lobes at T3 from left to right. Then lastly, the lower lobes from T10 left to right for one full breath sound, and all lung sounds are clear. Next, I'm going to go ahead and we're going to oscillate your heart sounds. Anteriorly, I'm going to start on the right side at the second intercostal space for your aortic valve. I'm going to come over to the left side at the second intercostal space at your pulmonic valve. I'm going to come down a rib to the third intercostal space to Erb's point. The fourth intercostal space on the left side for the tricuspid valve, and then lastly the fifth intercostal space for the mitral valve. A clear lub-dub sound is noted. The lub being the closure of the mitral and tricuspid valve, the dub being the closure of the semilunar valves. Next, I'm going to go ahead and inspect your abdomen. I'm going to start with auscultation of first I'm going to go ahead and inspect your abdomen. Abdomen is not distended, no lesions or trauma noted, skin is pink and intact. Sorry. Skin is pink and intact. Next I'm going to go ahead and auscultate each quadrant, starting in the right lower quadrant, and then the left lower quadrant, the left upper quadrant, and then the right upper quadrant for 1 minute unless abnormal sounds are noted. No abnormal sounds were noted between 5 to 20 bowel sounds per minute. Next, I'm going to go ahead and move on to your lower limbs. I'm going to palpate, no swelling or tenderness noted. Next, I'm going to feel for your pulses, the back of the knee, the popliteal pulse, behind the posterior tibialis behind the medial malleolus, and then lastly, the dorsalis pedis on the top of the foot. Pulses are 2+. Was that it?
I think so.
All right.